Why do hemorrhoids bleed, and how much bleeding is normal? If you have ever seen bright red blood on the toilet paper, that question gets urgent fast. Let's walk through what is actually going on. Quick note first. This is educational information, not medical advice. We cannot diagnose anything through a video. Only a doctor can do that. So why the blood? Hemorrhoids are cushions of blood vessels that line the anal canal. Everyone has them. When they swell, the tissue covering them stretches thin. Then a hard stool scrapes across the surface, or you strain, and that thin tissue tears a little. That is the bleeding. Those cushions are packed with oxygen-rich blood, so the blood is usually bright red. You might see it on the paper, on the surface of the stool, or a few drops in the bowl. Here is the classic hemorrhoid pattern. Bright red blood. A small amount. It shows up during or right after a bowel movement. And with internal hemorrhoids, there is often no pain at all. That is because they sit above a line in the canal called the dentate line, where there are almost no pain nerves. Now the important part. When is bleeding a red flag? Watch for these 5 signs. Bleeding that will not stop or keeps coming back. Blood that looks dark red, maroon, or black. Blood mixed into the stool instead of sitting on top. Bleeding along with pain and fever, or a change in your bowel habits that does not go away. None of these mean the worst case automatically, but other conditions can bleed too, and nobody can tell the difference just by looking. Those signs are exactly what doctors want to check. One more thing, never write off blood as just hemorrhoids on your own. Even mild bleeding is worth a mention at your next doctor visit. Want to go deeper? Hemorrhoid.com has plain English guides on all of this, free. And if any of those warning signs sound familiar, make the appointment. Thanks for watching.